Welcome to the NBNU podcast, a space for real conversations about the issues that matter most to nurses in New Brunswick. I'm Joanne, and today we're talking to one of our Labour Relations Officers, an in-house health and safety lead, Josée Gaudet. To start us off, we want to ground this conversation in who you are and why this work matters, especially for nurses listening who may not see themselves reflected in OHS conversations yet. For members who may not know you yet, can you introduce yourself and share what drew you into occupational health and safety work?
Absolutely. So, as Joanne mentioned, I'm Josée Gaudet. I'm one of the Labour Relations Officers with NBNU, currently assigned to the Zone 1B locals with Vitalité as well as the French nursing homes in the region. I have been a registered nurse for over 30 years. Time flies. My career path has not been a traditional one from a nurse point of view. And occupational health and safety kind of fell on my lap. I worked as a case manager with what is now called WorkSafe NB several years ago. And following this, I worked in disability management and health and safety with Vitalité Health Network for a few years. I do want to specify that I am not an occupational health and safety specialist. I do not have any occupational health and safety certifications, but I do have experience with occupational health and safety within the healthcare sector, both in hospital, community setting, as well as the nursing home setting.
Yeah, and nurses, I think, hear OHS all the time, but from your perspective, what does OHS actually mean for nurses on the floor day to day?
Yeah, that's a great question, Joanne, and an important one. Occupational health safety is probably the most important component of a nurse's job every day. If a nurse works safely, this impacts both her well-being, the well-being of her colleagues, both physically and psychologically, and it also has a direct impact on the quality of care provided to the clients they care for. We all come into this profession wanting to care for others. If you're working safely in a safe environment, both physically and psychologically, you're going to take care of your patient and patients are going to be well cared for. And this is regardless of if they work in a hospital, in the community setting, or in a nursing home. It impacts all the work that the nurses do in different environments.
Yeah, I think that's really well said, and it helps connect OHS to nurses' everyday reality. And I find, despite how central it is, we still hear a lot of confusion, and hesitation around it. So, what are some misconceptions that you think nurses may have about occupational health and safety?
I think this is a good point. Like, not only nurses, I think everyone that works in any type of job, everyone's waiting for someone else to fix or address the occupational health and safety issues or risk of the job. They're waiting for the manager, they're waiting for the Joint Health Safety Committee, but the nurses themselves need to take ownership of their own occupational health safety. And this is by reporting risks, reporting incidents and near misses, getting involved and getting informed, because it's not okay to just let things by, not say anything, not report anything. We all own our workplaces and we need to take ownership and say, look, I need to get involved. I need to speak up. I need to report. And that will make our work environment safer.
Yeah. And I think it's important that it's seen as something not as a task that's put on them, but more a privilege and something that they're empowered to do to take charge for that. So when you think about the realities that nurses are facing today, what are the biggest OHS issues that you see?
Yeah, and I think if we think of across Canada and even across North America in the world, we're all seeing pretty much the same thing. I'm presently a member of the Canadian Federation of Nurses Unions Occupational Health Safety Networking Group, which basically CFNU, like most people know, that includes most nurses unions in the country. And when we meet, we're all discussing the same thing at various degrees. Violence in the workplace is the main topic, as well as psychological health and safety. So violence in the workplace, we're not going to blame it on the pandemic, but it certainly did not help. The healthcare sector really took a hit during the pandemic. And, our healthcare system in Canada is not great. We all know that. We're trying to make it better. So it makes that families, patients are more aggressive and the nurses are not safe. They're being verbally and physically abused, and we need to make it better. This is not new, but I think in the last few years, it's gotten worse. Some provinces are making progress in protecting nurses better. And I say that because they've got buy-in from government. They've received funds to enhance security and establish health and safety programs. But the nurses are still very reluctant to report incidents. Every time I speak about occupational health and safety to our members and I do some teachings, I always say you need to report incidents. Like, it's not part of the job to get punched, kicked, or verbally abused, even if the patient is not well. And that's where the reluctance comes from. When you have a mentally ill patient, when you have an elderly patient that suffers from dementia, oh, well, he didn't mean to, he's sick. We need to report because the employer needs to ensure that we're safe at work, and that includes protecting us against those risks. So that's pretty much the hot topic. We've been discussing it for years, but you're going to see a lot of campaigns from CFNU nationally. We're trying to get government to react and to increase safety measures in place in the hospitals and in the community settings and nursing homes.
So, why should all nurses, care about OHS beyond the mandatory training?
Yeah, nurses should care about occupational health safety since it is their workplace and their health and well-being. Like, everybody wants to come home at the end of their shift and not be injured, not be harmed. But the more involved they are, the better, and the more they report, the better. They need to get involved. They need to be engaged in occupational health safety. We need to normalize a conversation, and that's everywhere. I see actually some in New Brunswick, some units that have a safety talk at the beginning of every shift. I think that's wonderful. We should have that everywhere. Are there patients that are more are risk today? What measures do we need to take in place? What's happening today? The issues that might come up today, and what can we put in place? We need to do better, but I think some places are making improvements, but we need to continue on that. But that, the nurse needs to engage in that. We need to, it's our health and safety. So they need to get involved.
Now, we know nursing is not only physically demanding, and we have touched on this a little bit as we talked, but can you speak directly to psychological side of health and safety?
Yeah, we're hearing a lot of buzz in the last couple of years for sure, but psychological health and safety is definitely getting more attention because the CSA standard was developed, ISO standard as well. The CSA standard is currently being revised, but psychological health and safety is just as important as physical health and safety, but you cannot see or touch it as you do with physical health and safety. Like, if you need a lift to lift the patients, that's easy to measure, to see, to touch. But psychological health and safety is not easy, but everybody needs to feel safe physically and psychologically as well at work. So it is the new buzzword. It's not law yet. It is coming. I have confidence that WorkSafe across all the country is going to make it law. It's not there yet, but it's coming.
And I know you say we can't see, psychological safety in the workplace, but if we could, if we could imagine that, what could it look like? What are those key principles of psychological health and safety in the workplace?
That's a great question because a lot of people, that's the first thing when I started to study and kind of research that. It was like, what does that mean? Like, what does that look like? And key principles of a psychologically healthy and safe workplace, it's really got, like, there's 13 factors, which I won't go into them specifically, but the key principle is like promotion and awareness. A workplace that continuously upholds psychological health and safety and makes tools and resources pertaining to mental health more accessible for employees and managers. And the and managers is an important factor. Like, we need to train supervisors and manager of how to have them more knowledgeable in mental health and noticing signs of an employee not doing as well, making sure they know the resources, and that the employees also have access to the resources. And then it's normalized. There's also encouragement and engagement and support, like a work environment where employees receive encouragement and support when addressing their psychological health concerns. Like, psychological health and safety is not to treat specific mental health. It's to have a work environment that encourages good mental health, that the employees don't feel a lack of support and a lack of encouragement to achieve that at work. And the culture of respect is a big one. A working environment where employees feel validated through a culture of respect and understanding, where you walk into work and you feel that everybody respects everybody, you work as a team, and there's the culture is created in the workplace. And that, lines into inclusion, a work environment where employees feel a sense of inclusion with the team and are not stigmatized. And the big one is the work-life balance. And I think for nurses, this is going to be a big one. And some of the employers in the province are saying, oh, we're going to, meet the standard for psychological health and safety. This is where they're going to struggle to meet. They've got a lot of work to do because a workplace needs to encourage balance between demands of work, family, and personal life. And we all know nurses are having to do, overtime, mandated overtime. They finish their shift and they haven't done everything that they were supposed to do. They still are thinking about work at the end of the shift. So I think that's the biggest challenge I think the employers are going to have when we're talking about the healthcare sector and the nurses' work-life balance. But it's an important one.
And you mentioned earlier that many nurses are still reluctant to report, hazards or anything they see as concerns regarding OHS. So how can, I guess, nurses look after themselves and advocate for safer environments without feeling like they're complaining?
Yeah, that's a great question, Joanne. And if anybody who's seen me speak in front of people, I say this often: report, report, report. They must report near misses, hazards, risks, incidents. If it's not documented, and all nurses out there know, if it's not documented or reported, it did not occur. And that is the most important thing, because they also need to talk about health and safety every day, normalize the conversation with colleagues and management, so that if there is a patient on the unit that's, has some behaviors and there's risk involved, talk about it with the team, get everybody involved, have a plan, but report it. And reporting is not to point anybody at fault. It's to, how can we minimize this risk? Was there an incident? Was there a near miss? Did I almost get punched? That's really important to document. So I think that's the most important thing. If we normalize the conversation about health and safety on the units, nobody's going to feel like, oh, she's just complaining all the time about the patients. No, you have a right to feel safe at work, and that includes the patients. And when they're not well and not, we all know they're not at their best. Some of them are at their worst, but it is a right that you have to be safe at work. So I think that's the best advice I can give them.
And it's not complaining; it's your job. It's you're advocating for yourself and your patients, really. So
Absolutely,
yeah,
absolutely.
Now, I'd like to, if we could, turn the conversation to joint health and safety committees, or known as JHSCs often. Now, a lot of what you're describing comes down to systems, and one of the most important systems nurses have access to is the Joint Health and Safety Committee. So can you explain in simple terms what a JHSC does?
Yeah, this is an important one. And just so everybody knows, like, the Joint Health Safety Committees is a legislative requirement for all employers in the province that has 20 or more employees. This is law. So an employer that has 20 or more employees can't just say, well, we're not doing a Joint Health Safety Committee. It is law. If your employer does not have a committee and you're more than 20 employees, call WorkSafe. They're going to come running, because it is law and the employer can be liable for that. What it is it's an important communication link between employees and management. They help create and maintain positive health safety culture. That's the basis of the committee. It is collaborative. It's not us against them. It's basically, the committee exists with an equal representation of both employer and employee, or close to similar representation, to discuss the health safety issues, to review the incidents, to review the reports, make recommendations to management, and sometimes do research, sometimes give ideas, and sometimes it's, we don't know how to take care of this risk, and we'll consult with WorkSafe to get help. So there's many roles. I won't get into detail because I could do a whole hour on that. But all the members of the Joint Health Safety Committee, they need to receive mandatory training within 1 year of being on the committee. And this is mandated in the Act. So if you're a nurse and you're on your Joint Health Safety Committee, the employer has a year to give you time to do that training. And the training's phenomenal. I don't know if it's it used to be 3 days. Not sure. I think it's an online and in-person combination now. But it talks about the roles of everyone. They train you on all the aspects of what the Joint Health Safety Committee role and mandate and all of those things. And just to add, now that I'm just thinking of it now, like, if you have a committee that's really not functioning well. It's not being efficient. You can call Work Safe and they will come and help you kind of work on your committee and make it more efficient. And that's an important part that people don't realize. They have a whole department of prevention and education where they can send an education consultant to go and work with your committee to make it efficient. And it's important to do that.
So I'm sure you've participated in or, been witness to many JHSCs over, your career. What if they don't know that it's not working? What does a strong committee look like?
And that's why my experience, I've been co-president of a lot of joint health safety committees on both the employee and the employer side, because some of my experience has been nurse manager for many years. And I've been on strong joint health safety committees. And what it looks like, it's the committee work collaboratively to get together. Like I said earlier, like if you sat in a committee that's being efficient and a strong committee, you can't tell who's the employer, who's the employee. So they're there to address health and safety issues as they arise in the workplace. It is not one side versus the other. Both sides work collaboratively together to address risks. And a strong committee, like I've had been on committees where it was a big employer, a big health authority, and a big facility. And like the committee would make written recommendations on risks that need to be addressed with, possible solutions to upper management. Those are types of things, and follow up with them and contact WorkSafe if it's not going well or not going the same direction, but all in the goal to address the issues. Let's work together to address the issues of occupational health safety, both on the physical and the psychological side.
So do you have some steps, any tricks for nurses who do want to be more involved, what they could do?
Yeah, the basic, and I did a little bit of training with the members over the last couple of years. The first thing, know who is on your local joint health safety committee. There's a committee. There has to be, because most of you work in an environment where there's 20 or more employees. I can't see many of you. And if you're in a clinical setting, even if your clinic is small, you're supposed to be linked to the hospital or a community health center. So you should all have joint health safety committees. So find out who's on there. Ensure that there's a nurse. And when I say nurse, I mean LPN, RN, or NP. Make sure there's a nurse on your committee. If you're not at the table, your voice isn't being heard. A best practice, and where I would like everyone to be, and I know some facilities and some nursing homes have that, is to create occupational health safety champions on every unit. So if I'm talking, one of my biggest facilities is the Dumont. There's a lot of units. Having one champion, or even more than one, that kind of is the health and safety person on the unit. They would do the inspections. They would be the go-to person to kind of have a daily conversation with, making sure issues are taken care of, having ongoing conversation with the manager about issues and follow-ups and things. And then they would link that to the person on the Joint Health Safety Committee. So that is the best practice, that where I'd like to be, but we're making baby steps and trying. Some facilities are doing much better than others, but we're trying to get everybody to that level, I guess.
Yeah, Josée on every unit, I think.
Well, yeah, I mean, you say that. It's not somebody who has experience. It's really not. I used to be a nurse manager on an orthopedic floor, and my PSW, my orderly that was on there, he was very passionate about health and safety. He would come and see me anytime there was anything that needed to be attended to. He did my inspections, and he did it very passionately. You need to find somebody who believes in it and wants to do the work, because it's important. The training, you can get the training, but it's somebody who says, no, we're going to work safely and we're going to make sure that things are addressed. And it's not a coming into my office and saying, you need to fix this. It's like, look, I've noticed these things. These came up on the inspection. Okay, let's take a look at it. Let's, address them as they come up, and normalize the conversation on the units.
No, I think that's a great point, that the learning can come later, and having someone who has that passion is kind of the first start there.
Absolutely. Yeah. And they exist. They exist.
So I think sometimes, OHS can seem maybe like noise in the background, or just kind of abstract, so I think it would help if we could hear what's possible, when concerns are actually raised and acted on. So I'm wondering, without naming any specific workplaces, if you could share a story or two where an OHS concern was raised, and if there's something positive that came out of it.
I could sit here, like I said, and give you many examples, but I have two that I like to talk about. when I'm talking to people, just to give them an idea. We had some nurses working in the mental health community setting. So nurses that are going to group facilities and doing home visits to give medication or therapy or follow-ups. And they raised concerns about feeling safe about it when doing home visits with certain clients. Not all of them, but certain clients were more at risk. And the Joint Health Safety Committee was able to get through a good collaboration with the employer to get personal alarm devices, contacting police when activated. So these are not just like they attach on your neck, and if you activate it, it doesn't call a dispatch like a operator. It calls the police, and police come because there were some situations that occurred, and we have some really big situations and even death related to home visits that were done in other provinces. So this is really important for these nurses to feel safe and how to assess, of course, and all that. But we were able, and that was a big win. And the nurses felt even safer. And we were working to develop, okay, what else can we do? The personal device is nice. What else can we do? Like, how do we assess the risk? And that's very important. Another example was one of our pretty significant facility, a lot of employees. Can't remember how many employees were there, but at least 100 employees worked in that facility. And there was health and safety issues, physical and psychological, in the parking lot because there was vulnerable populations that were circulating in the parking lot because their residential group home was right next to the parking lot. So we had some incidents, very significant incidents so we got right on board with the employer and even with the province. We even talked to the deputy minister of health to get things in place fairly quickly. And we were able to collaborate with the employer and add security personnel for the whole amount of time that the nurses were in the building, install cameras, and add lighting in the parking lot, which definitely did not put the risk at zero because a lot of situations we can't put the risk at zero, but certainly mitigated that risk. And the employees felt safer, and even the security personnel would escort the nurses to their car, which was a significant win for them. So those are just a couple of examples. Again, I could go on and give you more, but those are the two examples that I like to talk about. But there are many. There's some in the hospitals, there's some in the nursing homes, but those are the ones that come to mind.
I love it. I think those are great examples, and it's heartening, to hear that change has come from it. And you didn't need a huge movement. You didn't need, everyone on board. It was a couple questions and a couple connections. So,
and that was a result of the nurses reporting the risk, reporting the incidents. Like if no one had told us that this was happening, how would we have known? And how would he have known that we needed to do something? So it's all about the reporting, going back to the reporting, near misses, incidents, risks. Like it's quite important.
And I find it hard to believe anyone would see that as complaining,
Exactly.
purely advocating for your own safety, and your patients. So there are hazards that, we hear come up repeatedly, so in workplaces where that is happening, what can be done to avoid that?
Yeah, and that's a part where we're lacking, and I'm going to speak for New Brunswick because that's what I know. Hazards need to be identified in order to be addressed. Like we need to put them on paper, we need to identify them. This is where the reporting is important. The risk cannot always be lowered to zero. We're dealing with humans, we're nurses, but it is important to put mitigating measures in place to minimize the risk. This starts by identifying the hazards in the risk. And the way that we do it, occupational health safety, this is not new. If we went on a construction site, you would see these things being done naturally. We don't see that as much in the healthcare sector, but we need to get there. It's really through a thorough risk and hazard assessment that needs to be done on all the units, not just in a facility, on the units themselves. And it needs to be done at least once a year or when the risks and hazards of the job have changed. So say your clientele has changed, say the physical structure of your facility or your unit has changed, then you need to evaluate the risk. And if this is not happening, you need to talk to your manager or the Joint Health Safety Committee because the risk and hazard assessments, it's in the Occupational Health Safety Act. This is not something that the employer, so if you ask like the health authorities, they'll say, oh yes, we have lovely health and hazard risk assessments, but they're not done and they're not completed on a regular basis. They might have been done once and they say, oh yeah, we did it in 2019. Okay, well, we're 2026. So where's the one that was done in the last year? And that needs to be like the nurses speaking up and say, look, I'm thinking of the nurses that work in the emergency department, in the psychiatric facilities, or on a geriatric unit. These nurses, I could easily make a list of risks. What are we doing to mitigate those risks? It's, you have to start by doing the assessments and identifying the risk and the hazards.
Yeah, so for nurses who are listening right now, the big question may very well be, what do I actually do when I see something unsafe? So what are the top 2 to 3 things, nurses can practically do if they see something unsafe?
So again, and I'm going to repeat this a lot, it's report the hazard or the risk to their manager and do this in writing. And doing it in writing is an important part because you need, and I always say this to nurses, if it's not written, it's not done. This is something that I say a lot. It might not be proper, but it's like covering your ass. If you report a risk, make sure that it's not only verbal in the hallway, telling your manager that this has occurred, it's to report it in writing. All employers have a process in place to report hazards and incidents. Some have more formal electronic forms that you fill out. Some have paper forms. And if you don't have any or you don't know how to report, a simple email to your manager or talk with your manager and local president right away. Like, what do I do? How do I report this? Is, I think, the most important thing that you have to do. You need to report it.
So when should they file the incident report? And what would happen to that report?
When to do it? When something almost happened. Tend to not report what almost happened, the near misses. And those are the most important ones to report because I almost got punched today by a patient because he got aggressive. Thank God I didn't get punched, but you need to report that because maybe the next one that's going to try to give him his medication or her medication is going to get physically assaulted. You need to report that. Or after an incident has occurred, whether there was an injury or not. So whether you were injured or not, if there was an incident, could have affected your health and safety, you need to report it. This report documents the incident and is reviewed by the Joint Health Safety Committee members. So depending on your committee, usually they will review all the reports or summarize the reports, depending on the size of your facility, and discuss it. Because if you've got one unit that has 15 reports in a month of incidents, that needs attention. But if it's something a one-off, they'll say, okay, well, and then they can follow up with the manager and make sure that was addressed. But if there was an injury or missed time, this is automatically sent to WorkSafe by the employer. So there's legislation involved, but when a person is injured, then they will, but sometimes the injury occurs after the incident. Say something traumatic occurred, you witness something, and at the time you don't report it, you say, oh, whatever, and you start having symptoms 2 months after, 3 months after. If you didn't report it, you might have issues getting a WorkSafe claim. So also important to report it, even though, it's fine, this occurred, I'm fine. You can't predict the future. You might have a moral injury, like a psychological injury, or you could develop a physical injury due to that incident. So very important to report as soon as possible the incident or the near miss.
And we've spoken about how crucial it is that, the employer and employee are collaborating. So how can nurses work with their employer as opposed to against them, to build that safer environment?
Yeah, that's a good one because we can't, when somebody walks into the manager's office, and it's true, when you read the legislations, like the employer needs to make sure your work environment is safe, but the employee also has, the nurse has a role to play. And my biggest recommendation is to get involved with the health safety in your unit. Talk to your coworkers and your manager about how to make the workplace safer every day on every shift. It's not a blaming game. Everyone needs to participate in addressing the hazards and the risks. So make it normal and make it usual to have, safety talks, safety meetings, and discuss it openly because everybody at the end of the day, including your manager, wants everybody to be safe.
Yeah, and before we wrap up, I think it's important for members to understand how and where NBNU fits into all this. How does NBNU support members around OHS issues?
Yeah. Like our focus right now is we don't have any dedicated staff. Like I'm called the lead, but I have a full caseload as a labor relations officer, so I'm not dedicated. So I think, as we progress, our focus right now is to really provide training to our members about the basics, provide some training to our executive locals, but all members can contact their local president or their labor relations officer with any occupational health and safety issue if they don't know how to address or report it. So for us, it's information is power, knowledge is power. We are putting in training. There's more training to come. It's a big goal for us. And as we get more advanced in the training, then we can get more specialized in what we teach. But the basics is the most important thing right now and the focus.
So as you sit here today, as our unofficial lead here, what is one thing you wish every NBNU member understood about their rights, responsibilities, and protections around health and safety?
Everybody needs to understand that all members, all nurses have a right to a healthy and safe workplace, both physically and psychologically. But they need to get involved. They can't wait for somebody else to fix it. They can't wait for the colleague to report it. Oh, I don't feel like reporting what occurred today. They need to identify the hazards and the risks. They need to report any incident or near misses. And they need to participate in finding solutions. Like, you can't just, put the employer on the table and say, you need to fix this, you need to fix this. Bring solutions. Like, especially with an aggressive patient, you know the patient, you've treated the patient, you know what's going on with the patient. What are solutions? What are things that we could put in place? Be a part of the solution. But they need to get involved and ensure they have, I think this is the most important thing. You need to make sure that there's a nurse on the Joint Health Safety Committee. If the nurses don't sit on the committees, I've been on committees where the nurses didn't have time to come and didn't come. And all we talked about was the physical occupational health safety risk. The nurses were not reporting any violence in the workplace. They weren't reporting those things that nurses face every day. So it's really, really, really important. If I can say one message, go back to your employment, your place of work, and who's on your Joint Health Safety Committee. Is there a nurse? And make sure everybody knows who it is, and then start the conversation. I think that's the most important message I can give today.
Josée, thank you so much for being here today, for grounding OHS in the real and lived experience for our nurses, and for reminding us that safety isn't about complaining. It's about caring for ourselves, our colleagues, and our patients every day. Much appreciated.
It's my pleasure, and thank you, Joanne. It was an important conversation and an important topic, so it was my pleasure.
To our listeners, thank you for joining us for this episode of the NBNU podcast. Stay connected. Watch for updates on our website and our social channels. And thank you for everything you do for the people of New Brunswick every single day.